So today we're going to do some neurological testing. I believe you may have some neurological deficits according to your clinical presentation. So we're going to do the upper limb test too. We're going to do Froment sign and prone leg bending. Okay, so we're just going to do upper limb tension test too. So that one we're just going to test for the median nerve, the musculocutaneous nerve, and the axillary nerve. If it's affected at all, if there are any lesions. So basically this one involves me putting your upper limb into, manipulating it into a specific position, test for any numbness or tingling in your arm. So if you have any of that, please let me know. And also, you have the right to stop me at any time. So do I have your consent? Okay. So just lay down for me on your back. Okay. So I'm just going to depress your shoulder, supinate your arm, kind of flex your wrist and fingers, and then I'm going to laterally deviate. And I want you to bend your neck to the opposite side. Is there any pain? Okay, good. So that's negative. And just sit up for me again. So now we're going to do the Froment sign. So it's just going to involve me putting a piece of paper in your hand and you trying to hold it while I try to pull it away from you. So it'll be positive. It would be positive if I can pull the paper away from you. So that means that you have paralysis in the adductor pollicis muscle. Okay, so just try to pull it away from me. Okay, so that's negative. And then the last one is prone leg bending. So this one just involves me putting your leg towards your buttock when you're lying down to reproduce any symptoms. This one will test for any nerve root lesions in L2 or L3. So positive symptoms may include pain in your lumbar area, buttock, or posterior thigh. So just lay down on your stomach for me. I'm just going to come around this way. So let me know if you have any pain. Okay, good. Okay, so today we're going to do some cranial nerve testing. We'll do all 12 of the cranial nerves except for glossopharyngeal nerve, number 9. We'll start with number 1, olfactory nerve. The normal response for this is just for the patient to identify the substance. So Eileen, I'm just going to get you to close your eyes, and I want you to cover one nostril. And with the open nostril, just tell me if you smell anything.
Yeah, I smell it.
Okay, you know what it is?
Cloves.
Good. Okay, so that was negative. Now we'll do the optic nerve. So this one, I'll just be shining a flashlight in your eye while you have the other one covered. Normal response is for the pupil to dilate. The pupil's dilating, that's good. Negative. We'll do cranial nerve 3 now. It's oculomotor nerve. So for this one, I'll just have you look straight ahead and then look up without moving your head. Okay, so that's a normal response. The pupils, the upper part of the iris is covered by the eyelid. Eyelid retracts, the upper eyelid retracts a little bit, and it's both symmetrical, so that's good. Next is the trochlear nerve. It's gonna ask you to cover one eye, and then I'll just bring my finger to the side and down, and the normal response is for the eye to follow my finger. Do you still see it? Or? No. Okay, good. So I followed my finger, so that's good. Next we'll do trigeminal nerve. This one just involves me touching your chin, your cheek, and your forehead with a cotton swab, and you need to be able to identify which parts of your face I'm touching. So just close your eyes. Raise your eyebrows. You feel that?
Huh, yeah.
You feel that?
Yeah.
Feel that? Okay. That's negative. So now it's abducens nerve. So this one, I'm just looking. I just want you to look straight ahead. Okay, so the normal. I just want you to look straight ahead. The normal response for this is the eyes are both symmetrical and they're looking the same direction. That's good. So it's negative. We'll do the facial nerve now. For this one, I just want you to close your eyes, raise your eyebrows, and then puff out your cheeks. Okay, that's a normal response. That's negative. Okay, so now we'll do the vestibulocochlear nerve. So I'm just gonna hit this tuning fork and put it on your mastoid process behind the ear, and I want you to tell me when you don't hear any sound anymore. And then I'll bring it up to your ear, and if you can hear the sound still, that means it's negative. So that's normal. You hear it?
It's gone.
So you hear it? Okay, that's good. Okay, so we're skipping the glossopharyngeal nerve. We're going to do the test of vagus nerve. So the normal response is for the soft palate to move upwards. I just want you to open your mouth and say ah. Okay, soft palate move upwards, so that's the normal response. It's negative. We're going to do the accessory nerve, so we're going to test for upper traps and sternocleidomastoid. So I just want you to resist my movement. Okay. And now to the SCM, I'm going to ask to move your head like this, rotate the opposite way, and then resist me. Good. So that's negative. That's normal strength. And the last one is the hypoglossal nerve. For this one, I just need you to stick out your tongue. And it's symmetrical and even, so it's normal response. So that's good.